Hello everybody, welcome to my YouTube channel. My name is Iriarte, and today we are going to check the medial side of the knee with ultrasound. Okay, so let's go. In the first video we checked the anterior side, and now is the turn of the medial side. In this side we will find the medial joint line, the medial meniscus, the medial collateral ligament, and the Pes Anserinus. Let's start with the position of exploring the medial side. I usually ask the patient to externally rotate the tibia and the hip. In this position we will have a good access to the medial side of the knee, and I also tend to place a pillow below the knee to make the patient more comfortable. Okay, and what about the medial joint line? So we will find the medial cortical of the femur, the medial cortical of the tibia, the medial meniscus, and the cartilage, as you can see here. To do so, we place the probe with the orientation of the leg in the medial and the medium of the knee and find this image. You can see here the femur with its cortical, the tibia, the medial meniscus, and the cartilage. As you can notice, the cartilage, we only have access to a very small amount of cartilage, the most superficial amount of cartilage. So this isn't a good technique to examine the cartilage of the joint line, as you can imagine. In this image, we have a quite acceptable view of the medial meniscus, but usually the deep portion of the meniscus is hidden to ultrasound. So if you want to check the meniscus, don't use ultrasound, just ask for MRI, because sometimes we will find tears in the peripheral area of the meniscus and cysts, but all the complicated tears and deep tears of the meniscus will be hidden. So we will not have a good view of the meniscus, and the medial meniscus nor the lateral one. But the opposite for the medial collateral ligament. We will have a very good and accurate image of the medial collateral ligament. And let's check the anatomy first. The medial collateral ligament has two fascicles: a deep fascicle, which is a capsular thickening, attached to the medial meniscus. So the relationship between the medial collateral ligament and the medial meniscus is very close, and usually the injuries are associated. Okay. It has two components: the meniscofemoral component here, which is longer, and its insertion is below the superficial origin in the femur, and it has a length of 15 millimeters more or less. The meniscotibial component is shorter, as you can see, and it has a length of 3-5 millimeters, and its insertion is very close to the medial joint line. The superficial component is longer and larger than the deep component, and let's make it transparent, and you can see here the relationship between the superficial and the deep components. Its origin is just below the epicondyle, and it has two distal insertions, one 1 centimeter below the medial joint line, and the second one 7 centimeters below the medial joint line. In this area, there is an area where the medial collateral ligament is not inserted, and as we are going to see, some structures are going underneath this medial collateral ligament at this area here. It has also an attachment to the medial meniscus on its posterior area. Okay. Now we are going to check this medial collateral ligament with ultrasound. This is an MRI. So we place the probe in the same position as to evaluate the medial joint line, but slightly anteriorly usually. If we are in this position and we cannot see the medial collateral ligament, just move slightly anteriorly the probe, and you will find this image here. Once you are here, just move the probe posterior or anterior till you find this image. It's a large ligament, and it's quite easy to see. Okay, once you are properly oriented in the same direction as the leg. Okay, now here you can see several structures we are going to examine. First of all, the medial joint line with the meniscus here, and the medial collateral ligament with these two components. The superficial component, as you can see here, is usually hypoechoic if we compare with the deep component due to anisotropy. Okay, it usually widens in its femoral insertion, and it's very important to check very accurately this area, because it will be the location of the 75-80% of the injuries of the medial collateral ligament. Okay, so very important to check this area. Okay, this is the medial collateral ligament, its superficial component, and this one is the meniscofemoral component here, and the meniscotibial component here. And so usually we cannot distinguish between the medial component, the deep component, and the meniscus, because they are together by ultrasound. Okay. Once you have checked these areas, don't forget to follow the medial collateral ligament distally, because it's very long ligament, as you can notice here in this panoramic reconstruction, and its insertion is here. Okay, very distal. Sometimes you will notice pathology here, but always check this area. Okay. In the medial side, there are other structures we need to check. First of all, the inferomedial artery and genicular, the inferomedial genicular artery and nerves. They are just beneath the superficial component of the medial collateral ligament at this oval-shaped area of the cortical. So when we are performing the evaluation of the medial collateral ligament, you must always seek the distal area of the cortical of the tibia here, with this oval shape here, and this will be the location of the inferomedial genicular artery and nerve, here. And the Pes Anserinus. The Pes Anserinus is called because of its shape, like a goose foot. Okay, and it has three components. The most anterior is the sartorius. The second one will be the gracilis, and the last one the semitendinosus. Here the sartorius, here the gracilis, and here the semitendinosus. And they are just above the superficial component of the medial collateral ligament, just here. And between the Pes Anserinus and the medial collateral ligament, there's the bursa, the Pes Anserinus bursa. Usually we cannot see this bursa because it has no liquid when it's normal. Okay. If we place the probe over the superficial component of the medial collateral ligament in its distal side, we'll find this area. This is the cortical. Don't forget to have a good view of the cortical of the tibia. And here, in this concave shape here, we will find the artery. Usually we cannot see the genicular nerve, but we can see the artery. So we can use the Doppler to locate this artery here, and we will find just below the inferomedial genicular nerve. You can see here the superficial component of the medial collateral ligament, and this image here, here, and here, which are the tendons of the Pes Anserinus. If we want to locate these tendons and to evaluate these tendons in its long axis, then we will turn the probe towards the thigh, here with this orientation, till we find this image. This is one of the tendons on the tendons on its long axis, and we can repeat the same procedure on all three tendons. Okay. Now we are going to see these images with a video. We start in the medial joint line, and here you have the insertion of the medial collateral ligament on the epicondyle. You can see here the fascicular component of the superficial layer, and here the meniscofemoral layer here, component here, and the meniscotibial here, and its relationship with the medial meniscus. If we go distal, always check to have a good view of the cortical of the tibia here. And now you can see the inferior medial genicular artery, and the nerve should be located here. And again, this is the medial collateral ligament and its superficial component, and the relationship with these two tendons here. Notice with anisotropy here, both tendons are hypoechoic, but when we are perpendicular, they become hyperechoic. In this occasion, we can only see two components because this one is the gracilis and semitendinosus tendons together, joined, mixed here. Okay? And we are going to see what happens when we turn the probe over one of these components. Now, okay, take a look at the probe, and now you can see this image here. Okay, so we can have an accurate view of the tendons of the Pes Anserinus in both short and long axis and its insertion on the tibia. And as you can notice, we cannot see the bursa. Okay. And that was all I wanted to tell you about the medial side of the knee. The medial joint line and the medial meniscus are not accurately evaluated with ultrasound, but the medial collateral ligament and the Pes Anserinus are. So you can use ultrasound to assess these structures. Okay, and that was the medial side of the knee. I hope you like it. And the next video will be about the lateral side of the knee. Thank you very much.